once again to Health Talk with Fiifi. With me, Ajua Duma Ansa. Thank you for always liking, sharing, and commenting on our videos. So today we are talking about stroke. I know you've heard about stroke and you want to know more about it. So do I want to know more about it. So I have with me here Miss Shine Oye. Welcome, Miss Shine.
Thank you very much.
You're looking good.
Thank you.
All right. So today we want to talk about stroke. Can you please tell us what stroke is?
Okay, stroke. When we say stroke, stroke occurs when the blood vessels in the brain ruptures, okay, or there is a blockage in the supply of blood flow to the brain.
Okay.
Now, the rupture and the blockage prevents oxygen and blood from reaching the brain's tissues. Okay, and the brain performs many functions, like it controls our movement, and also it is the source of our emotions, our thoughts, and our language. So, in order to work properly, it needs oxygen. Okay, but if there is a blockage in the supply of blood to the brain, that is where stroke
sets in.
Yes.
Okay. So if I have stroke, what are the signs of symptoms that will show that I'm about to get stroke or I'm having pre?
Okay. So when you have stroke, you may have a problem speaking and also understanding people. Since I said it's a source of language. Okay. So if you have stroke, you may be in confusion, you may be confused, and you won't be able to understand what other people are saying to you.
Just because the brain is not functioning.
Yes,
Okay.
yes. And also, you might have sudden numbness in the face, the arm, and the legs.
Please, the sudden what?
Numbness.
What does it
like
mean?
paralysis.
Okay,
Uh-huh.
okay.
So it often affects just one side, like one part of your body. Okay, so mostly, if you want to know that maybe this person is suffering from smoke, one, you have to check the face.
Okay.
So with the face, the person won't be able to speak properly, okay? Or when you ask the person to smile, you will see that the
Only
one side of the lip is drooping.
Oh, okay.
And with the arm too, the person won't be able to raise the arm, or it will be like, it wouldn't be on the shoulder level. Okay, so
That is
the
all
same
right.
thing.
Okay. So why do stroke happen? Why do they happen?
Stroke happens when, one, there's a blockage in the blood vessels, or the blood vessels ruptures, or it can be a temporal disruption of blood flow to the brain. So here I've mentioned three things. So this takes us to the types of stroke that we have. So we have ischemic stroke. Okay, this is where there's a blockage in the blood vessels. So when that happens, these blockages are caused by fatty deposits in the blood vessels, blood clots, and sometimes debris, which moves through the bloodstream and lodges in the blood vessel. Then we have the hemorrhagic stroke. That is when the blood vessels ruptures or it bursts, and it may result as maybe a condition, a health condition that you have, like a high blood pressure and diabetes. Then we have the transient ischemic stroke. That is also known as the mini stroke, and it doesn't last longer. It can last like as little as 5 minutes.
Okay.
Yeah.
Okay. So who is at risk?
Okay, so you're asking about the risk factors of stroke. So age is a risk factor. If you are 55 years or older, you are at a higher risk of getting it. Sex is also another factor. Men have higher risk of developing stroke than women. But however, women have stroke when they are older, and they may die from that stroke. Also, smoking, or let me put it, healthy lifestyle,
Healthy
risk
lifestyle.
factors.
Okay.
Risk factors. Okay.
Okay.
So if you smoke or you take in illegal drugs, you may.
So how can we reduce the risk of getting stroke?
Okay, so one, you need to manage your diabetes. If you are diabetic, you need to manage it. You have to control your blood pressure.
Okay.
Also, you have to quit smoking,
Smoking.
exercise regularly, and also, so basically, live a healthy lifestyle.
All right. So how can we diagnose? If I have stroke, how would they diagnose me of stroke?
Okay, so when you go to the hospital, a physical examination can be done to check your heart, like your heartbeat, and also your blood pressure.
Okay.
Blood tests too can be done to find your cholesterol level and your sugar level. Then you have the computerized topography scan, that is the CT scan, okay, to check if there's a bleeding in the brain. And then you have the MRI
Okay.
also.
So how can it be treated?
Okay, so you need to take anti-platelet drugs and also anticoagulants to treat it. And sometimes emergency surgery might be needed in case of hemorrhage.
Okay. So it means that if I have a stroke, I can be treated and I'll be fine.
Yes, please.
Okay. So do you have any advice for the youth out there? Some things they need to put in place in order to avoid this stroke?
Okay, yeah. So, all I can say is that you need to live a healthy lifestyle. You should eat diets that are rich in vegetables and fruits. You should also exercise regularly. And then, if you are a smoker, I'm advising you to please stop and also reduce your intake of alcohol.
Okay. But one more thing before we go, I wanted to ask, you said exercising. Those guys that visit the gym and be carrying those, is it also a form of exercise, or we have a specific exercise for?
No, so far as it's going to keep you fit.
Okay.
It's
calm.
It's calm.
Thank you so much for your
You're
time.
welcome.
Thank you for watching today's episode on Health Talk with Fiifi. I hope you've learned from our conversation. Make sure you tune next time. Don't forget to share, like, and comment. My name is Rosemary, and I'm your host. Bye. See you next time.